Welcome to our Caribbean and African Targeted Health Improvement Program, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery Community Fund.
Hello, good morning, everybody, and welcome to our health hour on Saturday. Today, we've got a really, really good topic, and we've got the wonderful Dr. Joan St. John, who is a GP with a special interest in diabetes. She's also a Diabetes UK clinical champion, and she's also co-authored a book about carbs and cows surrounding world foods, which I urge you to have a look at. Okay, over to Dr. St. John.
Thank you so much, Dr. Lebari. Can you hear me okay? And good morning, everybody. And thanks for giving up your Saturday morning to learn a bit about diabetes digits and what the numbers mean. So I won't be able to see the chat. So Dr. Lebari, can you see my slides?
Yes, we're good.
Okay, brilliant. So thanks very much for inviting me, and thanks very much for giving up your time to learn a bit more about diabetes digits and what the numbers mean. And I really appreciate CARN inviting me to share this time with you so we can all learn. As Dr. Lebari said, I'm a doctor with special interest in diabetes and also health inequalities as well. And I was one of the first Diabetes UK clinical champions, and I've co-authored this book, Carbs and Cows World Foods. And also I host a webinar series called Diabetes Health Matters, which I do in conjunction with Diabetes Africa, and more about that later. So let's see if we can get these slides to work. There we go. So I've used this quote, which is attributed to Dr. Martin Luther King Jr. As the inspiration for the talk, because he says there's power in numbers and there is power in unity. And I think there's power in this quote. There's power in numbers because if we know what our numbers are, we can use that to empower ourselves to have better health. And that's what I'm going to try and share with you this morning. The numbers, what they mean, so you can have some knowledge about the numbers, you can have some understanding about what they may mean, and then we can also empower ourselves to better health. Alongside that, he says there is power in unity. And I think it's so important that we recognize the power we have when we are unified and we are together. So this is the basis for the talk today. And I don't think he was talking about diabetes digits, but I'm going to use his inspiration. So what we're going to talk about is the knowledge, So get some knowledge of the numbers, get some understanding of what they mean, and hopefully work towards being a bit healthier. And which aspects am I going to look at? Because there's so many numbers that we could actually look at and examine here together this morning. But I want to look at a few. I want to look a few specific ones. So the risks, or I prefer to call it the chances of developing type 2 diabetes. We're going to look at things like blood glucose or blood sugar, as some people would call it. We're going to look at things like blood pressure and the numbers around that, and the fats or lipids. And we're also going to do a little bit about body composition and how that, how the numbers are important there. But before I go on to talk about that, I just want to ask if you can put in the chat how many people you think are living with diabetes in the UK at the moment. So how many people do you think are living with diabetes? And if Dr. Lebari can just shout out a few things that come into the chat. Do you think there's 100,000 people? Do you think it's more than that? What do you think?
Natasha's volunteered 1 million.
Okay, so what we have 1 million. Anyone want to go lower or higher than that?
Can I put in I'm going to say 3.5 million.
3.5 million. Thanks, Dr. Lebari. And let's have one more.
UCL says 2 million.
2 million. Okay. So thanks very much. You may be surprised to know, here are some quick facts, here are some quick numbers. So it's estimated that there are actually about 5 million people living in the UK with diabetes. But the other important thing, and maybe this is speaking to that quote that we talked about at the beginning, 1 in 6 of those people don't know that they are living with diabetes. So although we have 5 million people, actually the number who know are only about 4.3 million. So much higher than Dr. Lebari and Natasha were thinking. And maybe a lot of other people on the call today didn't realize that there were that many people living with diabetes in the UK. There are even more than 5 million at risk of developing type 2. So it's about 13.8 million. And about 5 to 10% of the total population of people living with diabetes are living with type 1 diabetes. A lot of people say to me, oh, back home, we don't have diabetes like this. But unfortunately, diabetes is a worldwide condition, and it's over 500 million adults living worldwide with diabetes. So huge numbers of people living with diabetes. And, the numbers are important. It's important for us to know what our situation is. And I love this quote. This is one of my favorite quotes. I was sort of inspired by poets when I was doing this presentation. This is attributed to Dr. Maya Angelou. Do the best you can until you know better. Then when you know better, do better. Yeah. And we all are trying to do the best we can in terms of our health. But hopefully, when we know better, when we have some more knowledge, when we have some more understanding, we can try and do better. Do the best you can until you know better. But then when you know better, do better. So let's bust our first diabetes digit. Diabetes Prevention Week occurs in this month, from May the 20th to the 26th. And I think the first digit that we need to look at is our chance of developing type 2 diabetes if you're not living with diabetes at this point in time. Now, I've called it a chance rather than a risk, because a risk suggests that it's something very negative. And I think if you understand the chances of developing type 2 diabetes, your personal chances of developing it, there is something you can do about it. There's lots of things you can do about it. So I think it's really important to know where you are, know your baseline, know your numbers. And it's very simple. You can go to a web browser, you can type in know your risk. It will take you to an online risk assessment, 7 questions, which will take about 2 minutes of your time. So only a short amount of your time, which is a huge investment in your health, to know what your risk is. If you don't want to do that in your web browser, I've put the link there. There's also the QR code. So if you're on your laptop, you can shine your the phone camera at the QR code, and that will take you to the site as well. It asks you 7 questions which are going to take about 2 minutes to complete. You will need a tape measure to measure your waist circumference. It's a good idea to know your weight so you can answer these questions as well. And it will give you a risk score. And I'm going to show you what that score is going to look like. So here's our first number. It will give you a risk score, and this risk score here is 19. I'm not sure how clearly you can see this slide, but if I talk you through it. So if somebody's answered the 7 questions, it's come up with an actual figure, and the actual figure for this person is 19. And 19 means that their risk of developing type 2 diabetes over the next 10 years is actually high. And they've said that 1 in 10 people who have a risk score of 19, as it happens for this person, will develop type 2 diabetes within the next 10 years. And it gives you a breakdown of what you can do now. So you can ask for an emailed letter to come to you, which you can take to your GP or your healthcare provider. And that person, your healthcare provider, can do a blood test to tell you specifically what your risk of developing type 2 diabetes is. This has given you an indication whether it be low, medium, high, or even very high risk. And it explains what the risk score breakdown is. So if you can imagine, if you can see on the right-hand side of the slide, how that risk score is made up. So your age is one of the things that can add to your risk. And as far as I know, nobody can reverse their age. So your age is your age, and that's going to give you a certain number in the risk score. Whether you're male or female. So males are more at risk of developing type 2 diabetes than females are. Your ethnicity is one of the important factors that will contribute to this risk score, as well as if you've got a family history of somebody living with diabetes. All of those things add to your risk score. Now, all of those things you can't really do anything about. You can't do anything about your family history, your relatives. You can't do anything about your ethnicity. But on the right-hand side of this slide, you can see the things that you could do something about. So things like your waist circumference, you could do something about that, and more about that later. And also your body mass index. And whether you have high blood pressure, yes or no, is one of the things that adds to the risk score. So this gives you the first number that we're talking about. A risk score assessment, which you can do online, which gives you an indication of developing type 2 diabetes, whether it's a low, medium, high, or very high risk, and what you can do about it. I mentioned the waist circumference because, again, a waist circumference is giving an indication of where you're carrying perhaps excess fat. Now, you can see I have 2 beautiful models here from my family. And I can say that none of them were harmed in the making of this slide. But one of them, if you notice, when he's got the tape measure around his waist, is in the green range. And the other person is in the amber range. So I hope this gives you an indication that, like a traffic light system, if you're in the green, things are pretty good, it's okay. If you're in amber or red, actually is in red, then something needs to be done. And in this case, it's something needs to be done about that waist circumference, because when we have excess fat around our middle, it's an indication of what's going on internally. It's an indication that internally we have too much fat around our internal organs, and specifically around things like the pancreas, or within the pancreas, or within the liver. those two organs, if we're carrying excess fat in those organs and around those organs, it can interfere with the function of those organs and put us more at risk of developing type 2 diabetes. So you remember from the risk score assessment, waist circumference was one of the things that added to the risk. And if our waist is expanded, and we're not talking about trouser size here, I have to say that, then it means that we're more at risk of developing type 2 diabetes. Now, you can measure your waist by finding where the lower part of your lowest rib is and also where your hip is, and you measure your waist in between those two places. And an easier way to know if your waist circumference is more than it should be is if you know your height and you halve your height, then that gives you what your waist circumference should be. So it's an easy way to find out if there's an excess of fat, let's call it, or flesh around your waist, then you'll know that by your waist circumference should be less than half of your height, because it's so important where we carry that excess weight. So that's looking at one of the first digits, the risk or chance of developing type 2 diabetes, and within that, particularly your waist circumference. I want to go on to talk about blood glucose levels, and I think there can be quite a lot of confusion that happens when people are trying to look at the blood glucose levels, because we're looking at it in many different ways. So you'll see the slide on the left here is looking at the blood glucose level from the finger prick test, which many people have at home and is a way of monitoring how your blood glucose level is. But also you have blood tests which are done with your healthcare provider, and that's the picture on the right-hand side of the screen where somebody's got a big smile on their face and they're having a blood test. And I think it can cause quite a lot of confusion because it's basically the way we express those blood glucose levels. And this is our next digit that we're going to look at this morning. So this is where we're going to find out our knowledge. This is where we're going to have hopefully a better understanding of what these mean, and then to empower ourselves to have better health. You can express the blood glucose levels in a number of different ways. You can express a blood glucose, which you can get from the finger prick test, that picture that I just showed you. You can express your blood glucose from something called the HbA1c, which I'll explain a bit more about in a minute. You can express your blood glucose test from something like a continuous glucose monitoring sensor, and that is a different way of expressing your blood glucose. And I think the way I would explain it is imagine if you're going to talk about currency. So if you're going to talk about dollars, and that may be US dollars, that may be Jamaican dollars, that may be Eastern Caribbean dollars, that may be, you may talk about Nigerian naira, you may talk about different sorts of currency. You're talking about the same thing. You're talking about currency, you're talking about money, but you're just expressing it in a different way. So it might be sterling, might be euros, might be dollars. So imagine that with the blood glucose, it's the same thing. You can express it as millimoles per liter. You can express it as millimoles per mole. You can express it as milligrams per deciliter, and you may find this if you're in the States or if you're in the Middle East, is milligrams per deciliter is the way it's expressed, or time in range if you're using one of those continuous glucose monitorings. But it's the same thing that you're expressing, but just in a different way. Now, that person who had the online risk assessment with a high risk of developing type 2 diabetes, imagine we can express that blood glucose level in a number of different ways. So if you're at risk of developing type 2 diabetes, you have what we call impaired glycemia. Big words, all it means is you're at risk of developing type 2 diabetes. You can express the blood glucose level. So if that person had the letter and they took it to their GP or their healthcare provider, the GP or the healthcare provider did a blood test, it may be expressed to you as equal to or greater than 6.1 millimoles per litre. Or if you're in the States or the Middle East, it could be expressed to you as equal to or greater than 109 milligrams per deciliter. Or it could be expressed to you as equal to or greater than 42 millimoles per mole, or 6%. Now, we're expressing the same thing, we're just expressing it in different ways. And remember, think about it like currency. So if you were expressing it as euros or dollars or pounds, yeah, it's the same thing, just expressed in a different way. And it can cause quite a bit of confusion because people will say, you know, my blood glucose is 6.1 or 6.5, and then somebody's talking to me about a HbA1c, which they express in a different way. And it's hard sometimes to marry the two things together. But it's important to know which one you're talking about, whether you're talking about millimoles per liter, whether you're talking about millimoles per mole, so that you're on the same page and you're talking about the same thing so you can compare it. Because you need to know what your baseline is, you need to know what your aim is, and you need to know how you want to get there. So let's spend a bit of time and talk about the HbA1c, which is a blood test which can sometimes cause a little bit of confusion. What I want you to think about is the red blood cells. The red blood cells will carry the glucose around the blood. Red blood cells last for about 2 to 3 months. And by measuring the HbA1c, we can see how much glucose or sugar has stuck to the red blood cells over the previous 2 to 3 months. So it just gives an indication of how much glucose has stuck to those blood cells. If you look at the bottom of this slide, you can see that if you've got a high HbA1c, which is the red blood cell on the left-hand side, you'll have lots of glucose molecules stuck to it. And we can measure that and we can know that you've got a high blood glucose over the previous two to 3 months. Whereas you can see the red blood cell that only has like 4 glucose molecules stuck to it. So that person would have a low HbA1c. And that's how we measure that blood test that you have when you go to your healthcare provider. It gives us an indication of how things have been with your blood glucose levels over the previous 2 to 3 months. Now, throughout the talk, I've tried to use a sort of traffic light system so you can know what's normal, inverted commas, what's at risk, and what may be a bit high. So if we're talking about HbA1c, and we're talking about the diagnosis of diabetes, if you have a blood test, let's say you do your online assessment, you get your email, gives you a letter because you're at high or medium or very high risk of developing type 2 diabetes, you go to your GP or healthcare provider, you ask them to do a blood test, they do a blood test, so it's coming from your arm, not from your finger, and they say to you, your HbA1c is 42 or 43 millimoles per mole. You can see that gives you the amber range. You're in the amber range. And that means that you're at risk of developing type 2 diabetes. Some people would call this pre-diabetes. The proper name for it is a real mouthful, non-diabetic hyperglycemia. Some people will say you're at risk of developing diabetes or you're borderline, but you'll know because it's within that range. And if it's below 42, that's a normal level. And if it's above 48, it suggests that you have type 2 diabetes. Now, you may require another blood test to confirm that, but it suggests that you may have diabetes. So here are another set of numbers that we need to look at. Take a picture of it, memorize it, know what it's about. Because if you're at risk of developing diabetes, you need to know if you're in the green range, if you're in the amber range, if you're in the red range, and what you can do about it. So these are the three questions that I'm challenging you to know today, going on from today. What your HbA1c level is. If you're at risk of developing diabetes, you've been told before you're borderline or you're at risk, or during pregnancy you had diabetes, know what your HbA1c level is now. If you're at risk or you're living with diabetes, what's your target or goal level of HbA1c? Where do you want to be? Where's most healthy for you? So you can know what you need to do, because that's your third question. How can I progress to where I want to be with my HbA1c? Or how can I maintain the level that I am if everything's really good and there's no problems? So it's really important to know your blood glucose levels. Now, I've spent time talking about the HbA1c, but equally, if you're monitoring your blood glucose with a meter that you're doing a finger prick test with, you should know what those numbers mean. You should know what they should be, what you want them to be for you as an individual, where is going to be most healthy for you. Is it high? Is it low? What do you need to do to get there? So you can substitute for HbA1c, blood glucose. What's your blood glucose level? What's your goal level? How can you progress or maintain that level? So I'm going to go on to talk now about high blood pressure, but I wanted to spend a little bit more time before I do that. What I would say to you in terms of diagnosis or assessment of whether you're at risk of developing diabetes, I've spoken a bit about that. If you're living with diabetes, it's really, really important for you as an individual to know, again, what your HbA1c level is, what your target level is, how you can progress or maintain that. So that is something that you and your healthcare provider have to discuss. I don't want to give figures here today because I know as a clinician, for me, it's each individual I have to discuss that with and work out with them what is there going to be their best HbA1c for their health. So we can talk about ballpark figures, but I will stress again and again and again, as an individual, we are each so different. All our circumstances are different. You have to discuss this with your healthcare professional. Okay, so we're going to move on to talk about blood pressure. And most times these days, it's going to be one of these electronic blood pressure machines that will measure your blood pressure. And I'm sure lots of people have got these at home. And you can see some figures on here. This person's blood pressure is 136/77. And there's another figure there as well, which is the pulse rate. I'm going to ask Dr. Lebari again, because I'm going to ask you all, how many people do you think are living with high blood pressure? We found out that there are 5 million people living with diabetes, and 1 in 6 of them don't know that they've got it. How many people do you think are living with high blood pressure? Do you think it's more than 5 million? Do you think it's less than 5 million? How many do you think? And Dr. Lebari, I'm going to ask you if anybody's put anything in the chat.
Sure. Okay, so we've got one already, more than 5 million.
Okay, yeah, more than 5 million.
Yeah, another person concurs, more than 5 million. We've got 7
Okay.
million.
I think everybody's playing it safe.
Yeah,
Thank you. So some
okay.
quick facts about blood pressure. About is a lot more than 5 million. So a lot more people are living with blood pressure, high blood pressure, than there are living with diabetes in the UK. And if we look at adults, it's about 1 in 3 adults in the UK that has high blood pressure. And it's about a third of adult men and about a quarter of adult women that have high blood pressure. And blood pressure is about 2 figures. So I said it was 136/77. That first figure, that top figure, the 136, is what we call the systolic blood pressure reading. So your heart is pumping all the time, contracts, and then it relaxes. And when it contracts, that is the pressure in your blood vessels that is your systolic blood pressure. And when it relaxes, that is the pressure in your blood vessels that is the diastolic blood pressure. So 136 is the systolic pressure when the heart is contracted, and the 77 is the diastolic blood pressure when the heart has relaxed. And blood pressure is important because, blood pressure is important, diabetes is important. Blood pressure is important because it accounts for more than half of all strokes and heart attacks, but also it's a risk factor for things like vascular dementia, kidney disease, and heart disease. Now, you might ask, if we're talking about diabetes digits, why am I talking about blood pressure? Well, if you can imagine that both diabetes and blood pressure can affect what we call our cardiovascular system. So this is the system of your heart and your blood vessels, your circulation. And because they can both affect it, they can have what we call a cumulative effect. So adding together to your chances or your risks of having these other conditions like strokes, like heart attacks, like dementia, like kidney disease. So if you're living with diabetes, things like your blood pressure, and I'll go on to talk about your fats, the blood fats as well, become even more important. It was something that people used to ask me quite a lot when I was starting treatment for various conditions. If you're living with diabetes, your blood pressure is really important to keep that at a normal level as well. It's really important to keep your cholesterol at a normal level as well. Even more important, because you don't want to have the additional risk factors of the blood pressure and the fats adding to the risk factor of the diabetes having an effect on your cardiovascular system, your heart and your circulation. So blood pressure is important when you're living with diabetes. Blood pressure is important as a condition, a standalone condition itself. So we're going to talk about some of the figures to do with blood pressure as well. Now, on the left-hand side, I don't want you to concentrate too much on the table on the right-hand side, but on the left-hand side, it's a graph showing the systolic and the diastolic blood pressure. Now, again, we're using the traffic light system. Over here in the UK, we don't really recognize pre-high blood pressure. We recognize pre-diabetes or non-diabetic hypoglycemia, if you remember I called it, but we don't really recognize pre-high blood pressure. But there is an amber range of blood pressure where it may be at risk of going into what we call high blood pressure. So you can see the green box is what they've called on this chart the ideal blood pressure. And if you go along the left-hand side, that goes up to about 120, amber range up to about 140. And for your diastolic numbers, the green is up to 80 and the amber is up to 90. So if you have one of your figures raised, so that's the systolic or the diastolic number, either of those, if they're raised, that will be equivalent to high blood pressure. You can have what we call an isolated systolic blood pressure. So look at the red range. It could be that your systolic figure is 160, but your diastolic figure is 90 or 80. And that would be an isolated systolic blood pressure. You can have an isolated diastolic blood pressure. So your systolic blood pressure might be 120, but the diastolic, if you look down at the bottom, might be 100, and that's an isolated diastolic blood pressure. But let's talk about the ideal. So ideally, if your blood pressure, and these are ballpark figures, if your blood pressure is below 120 over 80, as a ballpark figure, it's likely that you'll be in the green range and that your blood pressure will be okay. If your blood pressure is 180 over 100, if you look along the left-hand side, then down the bottom, you'll see it brings you into the red range. 180 over 100 is going to be high blood pressure. That is high blood pressure, okay? So knowing your figures, knowing where your blood pressure is, knowing what your individual blood pressure should be is really important. So knowledge of what blood pressure is, so the systolic and the diastolic, the contraction of the heart, the relaxation of the heart, and those two figures, knowing what those two figures are, knowing what your blood pressure should be is really important in terms of empowering you to have better health. Now, I've said ballpark figures because if you are living with diabetes, whether it's type 1 or type 2, if you have additional risk factors, if you're living with kidney condition, a kidney disease, either associated with your diabetes or associated with your high blood pressure, you may require your blood pressure to be lower than the ballpark figure that I've given you. And I always stress that it's so important for us to be mindful of our individual health needs. I'm giving you general advice here, but as an individual, you need to know where you are on these charts and what your individual circumstances are. So general ballpark figures, if it's below 120 over 80, that may be fine. If it's 180 over 100, that's going to be high blood pressure. But remember also, there may be particular circumstances that require individual treatment. So the three questions that I asked about your blood glucose levels, it applies to your blood pressure as well. You should know what your blood pressure is. You can buy a machine if you want to. You don't have to rely on your healthcare professional, but there are lots and lots of options for getting your blood pressure checked. Certainly, you can get your blood pressure checked with your healthcare professional, the GP surgery, clinics. You can get your blood pressure checked in pharmacies. And as I say, you can obtain your own machine and do that. When you know what your blood pressure is, if your blood pressure is in the high range, how are you going to deal with that? What are the things that you can do? So knowing what the baseline is, cutting down on things like salt. Salt is particularly important if you're living with high blood pressure. And how could you do that? Well, gradually you could reduce the amount of salt that you're consuming. You can make sure that you don't just add salt onto the food before you've even tasted it. And we know lots and lots of people who do that. You can also make sure that you can taste the food before you add salt to it, if you feel you need to add salt to it when you get to the table. Because the other thing is, a lot of people, as soon as they're on the table, they're adding salt to their food. You can try and cut down on things like pre-packaged foods or takeaway foods, because they're going to tend to have more salt than you would add if you were cooking the food yourself. Moving more is really important for most cardiovascular conditions. So blood pressure, diabetes, high cholesterol, whatever condition you're talking about, cardiovascular condition, moving more is going to help you get to a healthier blood pressure if you need to. Being aware of the amount of alcohol that you're consuming, because alcohol consumed in excess can raise your blood pressure. So really important that you're aware of what you can do in terms of being healthier. Now you know what those figures should be. You've got that knowledge, you've got that understanding. How do you make things healthier for you? So what's your blood pressure? What's your goal or target level? And how can you progress or maintain that level? So looking at some beautiful foods here, I hope everybody's had their breakfast. And we're going to move on now to talk about fats. And remember, I said that when you're living with diabetes, it's not just about your blood glucose. You have to bring these other things in as well. You want your blood pressure to be optimized. You want your fats or the cholesterol levels to be optimized as well, so you can reduce your risk of having any issues in the future. So some lovely looking foods here, and there's a deliberate mistake in the middle, which we're going to go on to talk about. So I want to talk about the lipid levels, because if you have a blood test done with your healthcare provider or GP, it's not just going to be the total cholesterol level that you will have. You will have something called the HDL, which is what we call either the good cholesterol, sometimes called, or the protective cholesterol level. You'll have the non-HDL or LDL level, which is not protective cholesterol, or we sometimes used to call that the bad cholesterol, because your total cholesterol is made up of these two parts, these two components. It will also look at something called the triglyceride levels. So when you're having your level of fats done, it's looking at all of these different aspects, because we need a bit of cholesterol, but what we don't need, what is not good for our health, is that non-HDL or LDL part of the cholesterol, which is damage to our blood vessels, damage to our cardiovascular system. The HDL is the protective part of the cholesterol, which is actually good. And there's ways that we can increase that. So what are the figures with regards to the cholesterol levels? Where do you need to be? Now, again, please, these are ballpark figures for each individual, depending on your circumstances. If you're living with diabetes, your levels will be, required levels will be different. Your goal levels, if I can call it that, will be different. If you're living with high blood pressure, if you're living with heart conditions, they are going to be different. So these are ballpark figures. And please, as an individual, if you're living with any of those conditions, or if you're concerned about your health in some way, please, you discuss that with your healthcare professional. So these are very general levels that I'm sharing with you today. So remember, the total cholesterol is made up of the good cholesterol and the bad cholesterol, otherwise called the HDL and the non-HDL or LDL. So ballpark figure for total cholesterol, you're aiming to get that below 5. For the good cholesterol, it's different for men and for women. So for men, above 1, for women, above 1.2. And the bad cholesterol, or the non-HDL, you want that below 4 or as low as possible. So how do you get there? What sort of things can you do? Well, remember I said there was a deliberate mistake in that first photo, because the chicken legs, if you notice, had the skin on. Well, one of the things you can do is to take the skin, take the fat off, take the skin off the chicken, and that will help to reduce the fat, reduce the cholesterol. So cutting down on saturated fatty foods, things like meat pies, sausages, butter, cakes, biscuits, those sorts of foods. They contain what we call saturated fats, and you want to cut down on those because they're the ones that will give you more of what we call that bad cholesterol, the LDL or the non-HDL. That's giving you more of that, and you don't want more of that because that's not protective. What you want is more of the good fats. So having the unsaturated fats. So oily fish, we've got some salmon on this photo, avocados, whole grains, nuts, seeds, fruit, vegetables. All of those things are going to, your HDL, up that protective cholesterol. Olive oil is another thing. And doing exercise is also going to up your HDL, up your protective cholesterol. So whatever you can do, it says aim to do 150 minutes. Sounds like a lot. It's not that much when you break it down over a week. But whatever you can do, the way you can be more active, move more, is going to help to lower your cholesterol. If you smoke, just stop smoking. Can't say more than that. It raises your cholesterol. It makes it much more likely for you to have serious cardiovascular conditions. So if you can, try to stop smoking. It's not good for your health. So let's talk now about some body composition. And I've called it body composition because if we talk about body mass index, I know very often people can get very exercised by this. I want to talk about body composition and I want to talk about body mass index in the context of your waist circumference. Let's have a look on the right, first of all. So if we're talking about body mass index, it's your weight over your height. You can be a different height and you can be a different weight and you can have the same body mass index. You can be a different height and if you're the same weight, you'll have a different body mass index. Did I say that right? So if you're a different height and different weight, you can have the same body mass index. You can be a different height and the same weight, and you'll have different body mass index. The critical thing with body mass index, what gives it relevance and more meaning, is your waist circumference, because an elite athlete can have a high body mass index. But what the difference between that and somebody who's not an elite athlete is usually the waist circumference. Because an elite athlete will tend to have a high body mass index, but their waist circumference is well within that range that I showed you earlier on. And it's because they're not carrying any excess fat and they're not carrying any excess internal fat. So that the waist circumference is the thing that can give the body mass index more relevance and more meaning. It's where you carry your fat. If you're carrying it around your middle, the tendency is, the indication is that you'll be carrying it internally around your middle, around those organs, and it can do damage. Now, for people of African Caribbean heritage, it's important that the body mass index, in the context of what I've said about waist circumference, is below 27 kilograms per meter squared. So you would work out, whether you go online and work it out, whether you go to your healthcare professional and work it out, what your body mass index, ideally you are aiming for below 27 kilograms per meter squared. But I think waist circumference is really the critical thing. And I don't want to get too hung up about body mass index and the figures around that. But all I will say with regards to body mass index and African heritage people, it's important for us that our body mass index is below 27 kilograms per meter squared. There was a large study that showed there were different levels of body mass index for different ethnicities. And for us, this is the level that we're talking about. But the waist circumference, remember, is one of the really most important things, and that should be half your height. And that's not stood on your tiptoes either. That's just half of what your height is. So one of the other figures I want to talk about is numero uno. Number one, you yourself, your well-being, your mental health, your emotional, spiritual, physical, and social well-being. It's so vitally important. Can't put a figure to this, but remember, numero uno, you've always got to look after yourself. You put your oxygen mask on before you would help somebody else with their oxygen mask. And it's really important for you to look after your own health before you try and look after the health of others, be that your family or whoever it is that you're looking after. So always look after your own health. So I hope what I've tried to do today is to share some figures with you, and I'm sure during the Q&A we can talk about more figures. I'm not going to talk about figures for you as an individual. I will talk about figures in general because I think it's so important not to give the wrong message to you, because you as an individual need to know your own circumstances, your own health circumstances, and discuss that with your healthcare provider. But we can certainly talk about, in general, figures today, anything from the blood glucose to the blood pressure to the blood fats. So one of the things I'm going to challenge you again to do today is, what are you going to do differently? You have the online risk assessment, which you can do if you're not living with diabetes, to find out, is it a low, medium, high, or very high risk that you're at? What your figures are in terms of your blood glucose, what your figures are in terms of your blood pressure, what your figures are in terms of your cholesterol. If you like, some people like apps, some people don't. You can, on the NHS app, if you have the NHS app, you can actually check out, if you've had a blood test, what your figures are. And then you can monitor when you have another blood test, how your figures are doing. But I hope that you will know what those figures mean from today. Because sometimes I will say to somebody, this is your HbA1c, or this is your blood glucose level. And they say to me, is that good or is that bad? Now, I hope that from today, you would know for yourself whether that's good or whether that's bad, whether that's where it should be or whether it's not. So, talked about diabetes digits, but we've talked about diabetes digits in a much more broad fashion, because not only blood glucose, but we've talked about things like blood pressure, we've talked about things like the lipids, we've talked about things like the chance of developing diabetes, we've talked a bit about body composition, we've talked about those three questions, another digit, those three questions that you need to be able to answer. What is your blood pressure? Or what is your blood glucose? What should it be? How do I get there? So remember, cardiovascular conditions are the things like heart attacks, strokes, kidney problems, and all of these conditions like diabetes, high blood pressure, lipids, your family history, your body composition add into that risk. So these are conditions that you need to be able to do something about as much as you can to live a healthier life. Number one is to know what the figures should be. Number two is to understand what those figures mean for you. Number three is to find out how you're going to get to a healthier place. So, as I said, I was quite inspired by poets for this talk. So, Gwendolyn Brooks, who was the first African American woman to win the Pulitzer Prize for poetry, she wrote a poem about Paul Robeson, and she said, "We are each other's harvest. We are each other's business. We are each other's magnitude and bond." And I think it's so important that we look after ourselves, but we look after each other, and we look after each other's health, because Dr. Martin Luther King said there's power in numbers and there's power in unity. If we can empower ourselves to have better health, then together we will be much, much stronger. There is magnitude and bond. So certainly, if you've learned something that is helpful for you today, please share that with somebody else. This is one of my favorite sayings, each one teach one. And just to highlight to you, if you want to know more about diabetes, I'm so proud to be working with Diabetes Africa, doing a series of webinars called Diabetes Health Matters. This one that I've put up here was about type 2 diabetes remission and how can you do that with African Caribbean foods. So please check that out. We've got lots of videos on the website, and this next series is going to be starting again on the 23rd of May. And also Diabetes UK. I've worked with Diabetes UK and the wonderful Shola Adipo and Diabetes Africa to also do some quick videos to give you advice about different foods. So I'm going to put up here some resources that you can access that I've used in the talk, from blood pressure to healthy heart to the Diabetes Africa and Diabetes UK websites, and the NHS Healthy Living. And I want to say a big thank you and look forward to your questions.
Thank you very much for that fantastic walk through, Dr. St. John. Before we move on to the questions, I'd just like to give a big shout out and hello to everyone who is at the Gorton Health Hub, who is also watching and listening. So welcome. If you are around Manchester or the Gorton area, I'd advise you to get down there and get health checks done. Pregnant women have been invited as well to have a look what a good antenatal clinic should look like for African and Caribbean women. So get down there and see what's happening. You know, worst case scenario, you might learn one thing about yourself and your health. Great. So we do have quite a lot of questions.
Okay.
I can see that the feedback polls always also be put up on the screen. So if you do want to answer that, that's fine. So I'll probably just wait a few minutes for people to go through that. And then we can go through some of the questions.
Do you want me to stop sharing, Dr. Lebari?
No, it's absolutely fine in case you wanted to reference things, but we do have I will start on the questions and just try and answer the poll and hopefully you can listen as well. So Esther asks if your HbA1c is about 68 and you were started on medication, but then you change your lifestyle and that comes down to 42. Can you stop the medication?
So, Esther, I'm going to say it again, speak to your healthcare professional. And know, I suppose this is answering the second part of those three questions that I was saying. Yes, if 42 is what your goal is, and you've managed to do that through changing your lifestyle, it may be that you can stop the medication. But what I would expect is that your healthcare professional will repeat your blood test and make sure that in 2 to 3 months' time, you're still at 42 millimoles per mole. Yeah. So as long as you keep it at that level, however you keep it at that level, it's fine. But keeping it at that level is what's important, and monitoring it so you make sure that things don't drift up again to 68, I think it was you said. That would be what's important.
Okay, fantastic. Thank you for that. And Esther also wants to know, when is the best time to check your blood pressure?
Good question. So I think morning and evening, I think I'd have to say both, because some people tend to have a higher blood pressure as the day goes on. And getting the readings morning and evening is really useful. And the other thing I would say is normally what we would do is like the best of three. So it's really important that you do the blood pressure, how shall I put it, in an ideal way. You're sitting, you're relaxed, your arm is relaxed as well, and you do 2 or 3 readings and you take the best of those 3 readings. But morning and evening is probably the best time.
Thank you again. Fantastic. I hope that's okay with Esther. Hopefully you've heard those and everybody else. We've got quite a few questions as well from the social media pages. What do you think are the best exercises for managing diabetes?
Any exercise,
Okay.
anything, really, anything. Walking, just dancing. Sometimes I have a slide where I've got housework, and if you like, ironing, hoovering, vacuuming, dusting, swimming, tennis, anything really. It's about moving more. I think there was one of the talks this week on Tuesday, with the dietitians and nutritionalists on Tuesday. It says sitting is the new smoking, and that is really so powerful. We've got to move more. We sit so much. When you think about it, whether we're talking about, you know, sitting watching a box set, or we're talking about sitting watching the soaps, we sit at work, we don't move. And I think it's so important just to move, just to do something you enjoy. Dance. Put on your favorite tracks and just dance.
I concur. Yeah, dancing, good. Anything that makes you sweat, I would say. Anything that increases that heart rate a little bit more, you know.
Yeah,
Um,
anything. So, you know, it really can be anything. Seriously, it can be anything.
so for those of you who are, as the weather's looking better these days, those of you who've got all those weddings lined up and things, don't be sitting down at the wedding. Get up and dance when the music comes on.
Yeah.
Dance like no one's looking as well.
But, you know, Dr. Lebari, I mean, I'm a firm believer in dancing, and in your kitchen, just put on your favorite track and just dance in your kitchen. Nobody's watching. You can just do it.
Hmm. Thank you. Okay, so next question from the social medias. Are there any specific foods in our Black culture that we should avoid? I have a feeling this is going to be the information you can probably get from Dr. St. John's book.
So avoid in terms of diabetes or high blood
I
pressure.
don't think it's said, it's just any specific foods in our Black culture that we should avoid.
I would say no. I think it's more about the way the food is cooked, and it's more about the quantity of food, and it's more
Mhm.
about the frequency of food. So, there's nothing wrong with our food. I always say that. There is absolutely nothing wrong with our food. It is the way it's prepared, that can be important and can be relevant for you. It maybe is the quantity that you're eating, but no, there is nothing wrong with our food. It's very healthy.
Mm. I mean, there's a reason our forefathers have survived for so long.
Yeah.
Nothing wrong with our food. Right. Another question about food. So I don't think I can cook without salt in it. It would ruin my reputation in my family, but that's an interesting suggestion. So I think that's more of a statement actually than a question.
Okay, so then a challenge. I mean, it's like when you have sugar in your tea or coffee, or in your drinks, and a lot of people used to do that. And the way that people actually were able to reduce that or stop having sugar in their drinks was by slowly reducing the amount of sugar that they put into their drinks. And then it got to a point where actually, when you weren't having sugar in your drink, if you had sugar in your drink, it didn't taste good to you. So you can do the same thing with salt. I'm not saying don't put any salt, but one of the questions I was going to ask, and I didn't ask, was I don't know if people know how much salt is recommended per person per day. I think you'd be surprised to know it's only 1 teaspoon,
Hmm.
6 grams, 1 teaspoon of salt per person per day. That's what's recommended. So I'm not saying don't use salt, but try to consider reducing your salt if you're living with high blood pressure and you want to get your blood pressure lowered.
Hmm.
Reducing your salt intake may be one of the ways that you can do that. Of course, it can be the case that more medication can be added, but most people would prefer to find a more natural way of lowering their blood pressure. And what I'm suggesting to you, giving you that knowledge and that understanding so you can then make that choice about whether or not you want to do it that way or whether you want to do it by reducing the salt that you're having. So I don't want to, you know, do anybody's reputation. I want you to maintain your reputation, but for the health of your family as well, it might be useful to consider reducing the salt intake.
And my other suggestion with regards to reducing salt intake, this is something that I've done with my family, is and actually my mum, who is very kind of firm, doesn't listen to anything that I suggest, actually did take it on, is one thing I noticed is I reduce the salt gradually, and instead of salt, I make sure that I use other types of seasoning that are not salt based. So be careful about replacing sort of actual table salt as well with other salt based seasoning. And it's easy nowadays. You just have to look on the packet and see whether the major content is salt.
Yeah.
Because some of our other seasoning also has a high salt as well as high sugar content. But yeah, if you use other herb seasonings, you'll find that actually it gives a similar taste to the food, where you can actually make it whether a bit more sweet or a bit more sour, depending on what you're cooking, but without actually having to add the salt itself.
Yeah, absolutely. I mean, there's so many other seasonings that you can use. And I mean, I'm talking about herbs. Yeah, as you say, not the pre-prepared ones, because they tend to contain salt.
Mhm. Great. So
Herbs like whatever you want to use. I think it was Yarbo that I saw
yeah,
popped up. Whatever herbs you'd like to use.
I tend to use herbs like, so mixed herb is a good replacement for salt, I find. It's particularly the ones you can get from the shops that are already sort of just in a packet of mixed herbs,
Mhm.
because it has sort of the right balance of like things like the basil, the oregano, and that actually gives it a bit of a salty taste without actually being overpowering. Because I know some people don't like oregano; it can be quite overpowering. Basil is quite gentle, but again, if you get it in the wrong uh, proportion or quantities, it can be quite overpowering. So yeah, I sometimes just put mixed herbs and everything rather than salt. Someone's asking about pink salt. I don't know if you have uh, probably Dr. St. John can answer more about pink salt, whether that's a good
S-
alternative or not.
Salt is salt. So it's still the 6 grams, whether that's Himalayan, pink, rock salt, yeah, whatever salt it's salt. So less processed. Yep, I'm all for that, but still we're still having to keep within the 6 grams.
Okay, now the next question is related to additives again. So somebody asks, what sweeteners are the best? Is stevia healthy? I'm not diabetic, but I only have stevia. Um, does that increase the pure sugar intake, or is it a good swap?
It's a good swap. And some people will use other sweeteners. Stevia is plant-based, so it is supposed to be healthier in that way. Um, Ideally, some people can't do without that sugar sensation, that sugar taste. Ideally, what I would say is where you can avoid something, avoid it, like sugar, if it's not necessary. But if you feel you need the taste, stevia or those plant-based substitutes are fine to use. Yeah, honey, somebody's popped up. Is that
Mhm.
okay, Dr. Lebari?
Yeah, of course.
Somebody said, honey, is honey a God alternative? I like that. A God alternative for sugar. Yes, it can be, but remember, it will have the same number of calories as the sugar does, but it's a more naturally occurring sugar.
Okay, so another question that we had from the chat. Somebody was asking when you was talking about the waist circumference and BMI, whether can we then establish some sort of mathematical correlation of waist circumference to the BMI?
Not really. Not really. Because you can have somebody, as I said, elite athletes can have a BMI, a body mass index, which if you looked at it in isolation, you would think the person is in the obese category. Yeah. But actually they're not. They're elite athletes with a waist circumference of I'm going to talk about inches here, of 30 odd inches. So it's you can't really use that as a correlation for body mass index because it doesn't always apply.
Okay. So what about, so the next one is about blood pressure. So someone asked, how many times should we check the blood pressure? Should we do it weekly or is it daily? And won't that in itself increase the anxiety level?
Yeah, I'll start with the end of that question first of all. Yes, it will increase the anxiety level if you keep checking your blood pressure, but it may be that you need to be checking your blood pressure over a period of time for a particular reason. And this is why I always say it's so individual. If you are living with high blood pressure and the blood pressure seems to be going high when you go to, let's call it the doctor's office or your GP surgery, it may be useful to do a week, perhaps 2 weeks, if possible, of morning and evening readings of your blood pressure at that time, just so that you and your healthcare provider know what your blood pressure is at home and they can get a better indication of whether or not there is a need for action or not. So you might want to do it more frequently in those sorts of circumstances. If you go for a blood pressure check and your blood pressure is always normal, then I would suggest that maybe once every 2 weeks, once every month might be sufficient if you're doing it at home, if your blood pressure is normal. So each person is going to vary slightly depending on their circumstances. Certainly at your GP surgery or your healthcare provider, you should be getting it checked at least once every year or 6 months. But if it's out of your individual range, that may be once every month or once every week that you're getting it checked. You know, there are different circumstances. If you're pregnant and your blood pressure's raised, it's going to be different. If you're having kidney problems and your blood pressure's raised, it's going to be different. So each circumstance is going to be different, but just as sort of general advice.
Okay. And then the next one is to follow up on that blood pressure question. So should you do your blood pressure, should you do it on a fast or just after you've just eaten?
Not really critical with blood pressure, but you should be sitting down, you should be relaxed, your arms should be relaxed and supported. Those are more important actually than whether or not you've eaten. And you wouldn't want to like rush in. You know, sometimes I'm sure that you've had this, Dr. Lebari, as well. People will rush in because the bus was late or they're late for their appointment. And, you know, that is not the time to check your blood pressure. They've got to sit down, they've got to relax, their arms got to be supported, and then you take the best of the 2 or 3 readings.
I know when I checked my husband's during the UEFA Champions League matches, it was always raised. So that's not a good time either. You may be sitting down, your arm may be relaxed, but also that's not the right time.
Yeah, don't watch football or something like that and then check your blood pressure.
Yeah.
Not a good idea, no.
Okay, unless your team's winning, but even then,
Yeah, even then, your blood pressure is probably going to be high.
Okay, so another follow-up to Esther's question about the HbA1c, etc., and stopping medication. Someone's asked, will keeping it at that level and stopping the medication not risk rebound increase since there's already a deficiency in the glucose metabolism? Oh, this
Yeah.
sounds very technical, this question.
Yeah, absolutely. And that's why I said you have to monitor it because when you monitor it 2 to 3 months later, you don't want to see it drifting back up again. If that person has made radical changes to their lifestyle, and I've seen this, some people will make radical changes to their lifestyle, which they maintain. And if you continue to monitor your blood glucose levels, you will know that it's still within that target range, that goal range. And if it remains within that range, that's absolutely fine. But if you see it drifting up again, it may be that medication or whatever needs to be restarted. So absolutely, hand in hand with this must go monitoring.
Okay, and then the next one, is there a difference in the blood pressure in the right and the left arm?
There can be. Yeah, there can be. And the purists will check blood pressure in right and left. And certainly if you're making a diagnosis of high blood pressure, so if you didn't know you had blood pressure and you go to your healthcare provider and they are checking your blood pressure and they think it's raised, yes, they should do a right and left-sided blood pressure reading. So there can be. On the whole, there doesn't tend to be. It's not very frequent, but yes, there absolutely can be.
And I guess related to that is which I guess this is the similar question. Which hand should I use to check my blood pressure, or which arm, I'm guessing?
Usually we use the left one.
Mm.
Yeah, I mean, that's what we were always taught at medical school. Use the left one closest to the heart. That's the one that you should measure. But as I say, purists, you should also at some point measure the right side as well.
And I guess my question, if I can just input one really quickly, I know we are coming to the end. So if there is a difference in your blood pressure with the right arm and the left arm, so which one should you say let's say the left arm is giving you a higher reading, which one would you go with?
The left one, the higher reading,
Okay.
because it's a bit like somebody was saying with the blood glucose level.
Mm.
If you've gone there already, if you've gone to that level already, it suggests that there is an issue, that things aren't in that green range, if I'm going to use the traffic light system again. Yeah. So that's the one that requires treatment because that's the one that's going to put you at risk of having a cardiovascular event.
Okay. And I think on my list, and I can see in the chat, this was the last question so far. How far is it true that once you put honey in a hot tea or coffee above 70 degrees Celsius, that the honey becomes a poison?
That I cannot answer today. I think that person has very specific question there,
Mhm.
and has found some very specific information. I can't answer that question. I'm afraid I would have to go and look that up.
Okay.
But would you put something above 70 degrees in a drink?
I'm not really sure if our tea even gets to that. I know we boil,
No,
we say with the water boils in the kettle, but
boils.
actually, even when I've taken the temperature, it's not like 100 degrees. Otherwise, all the water would evaporate. So I'm not
Yeah,
really sure how it gets to 70 degrees either. You wouldn't be able to
yeah.
drink it.
I'm not quite sure. I'll have to look that one up.
Okay. Fantastic. Thank you, everybody. And thank you to everybody who sort of contributed such fantastic questions. Dr. St. John has definitely giving us a lot that we can do, a lot to think about, a lot that we can take away and maybe try to implement step by step. I would encourage you to have a look at that book, Carbs and Cows World Foods, because that's really important. And that statement is going to be my statement of today. I'm sharing it with everybody, which is when Dr. St. John said, there is nothing wrong with our food.
Absolutely.
There isn't. And just like a lot of things when it comes to health or our lifestyle, it's how we use it. It's, moderation in everything, or do we go to the extreme? It's how we balance that out. It's how what our food portions are like. Because although our forefathers ate the same food, they probably didn't eat the same portions that we are. Or at least if they did, then they would be out on the farm all day or out fishing all day. Whereas we eat the same portions and we sit at home and watch the telly. So so I think what I've taken from this is actually there's nothing wrong with our food. And on that note, I'm now going to make some fufu. So thank you all for joining. Thank you for everybody who joined at Gorton. Thank you for everybody who's watching on streaming on social media. And I hope you all benefited as well as I did. Thank you.
Thank you so much, Dr. Lebari. Thank you. And thank you to Khan for inviting me.
Perfect. So I just want to thank both doctors so much for the presentations and the interaction between you two today. It's very heartwarming and enriching to be part of the sessions and be graced by the knowledge that you have. And yeah, it was really, really good. So even, I think it serves people of so many ages and different backgrounds. So that was really important. Once again, we wanted to shout out to the people at the Cannes Wellbeing Hub. It's the first session ever, and we are so proud to have a physical wellbeing hub really focused on Black mothers and their families. And yeah, we are really, really proud of that. So go over to Gorton if you can. You can get your diabetes checked even. So that would be great. Again, doctors, thank you so much for your time. So I won't keep you all too much, but I do want to share my screen. Apologies, I only have one screen, so it will be a little bit more glitchy than normal, but it should be fine now. So first and foremost, I wanted to let you know that we do have a health hour every single Saturday, as many of you know that join every Saturday. And by the way, holla at everyone that is on LinkedIn, on YouTube, and other platforms. We've been seeing your interactions over there. There was even people asking for your slides, Doctor. So we need to arrange that. So we have a session next weekend with Dr. Julie, and we'll be on early parenthood. So postpartum challenge for new moms and babies. So this is not just a session for women, but also for men, because it's a joint task. So we would like to see you all next Saturday. The link is exactly the same if you already have this link, but go on and share with your family and loved ones. And further, we have sessions every Tuesday afternoon. This more focused on nutrition. I think some of you heard Dr. Joan mentioning that we had one on sitting and being not very good for your health. So this week is on PCOS and diet, the connections between the two, and how you can perhaps use diet to improve your symptoms. So here is on Tuesday 14th at 6:30, and we look forward to welcome you there. Then, as we know, we have Dr. Sylvia there and Dr. Anifat there as well, with Orlando making us move. So will be, as always, very, very interesting. So we do have the Black Healthcare Awards, first of its kind, fully dedicated to healthcare professionals, Black healthcare professionals. We really want to take this time to celebrate people like Dr. Dornu and Dr. Joan. They really give that time to the community and make a difference. So we really would like to incentivize you, first and foremost, to vote for your healthcare hero, someone that has made a difference in your life and has improved your health in so many ways that they do every day. So again, thank you to all healthcare professionals for your work, and we look forward to see you on the 27th July. This will happen in London at the Park Plaza, Westminster Bridge. So beautiful, beautiful, glamorous event. It will be an evening not to be missed, and you all are invited. The link is in the chat. And closer than that, we have Africa Day. Africa Day is this month of May, on the 25th. We are celebrating it on the 24th at the University of Bolton. We look forward to welcoming you there, completely free of charge. The stalls are fully booked, so we'll have plenty of African businesses there sharing and networking. There will be talks, there will be cultural performances, there will be food that can be purchased as well. So do join us in the morning of the 24th in the University of Bolton. As you can see, we have great partnerships there with GMCA, Greater Manchester Combined Authority, with the Igbo community in Manchester, with the Department for Business and Trade, and also with Crowdfunder. So it's a full house on that day. We are having a great event then. And next day, now in London, we have an Africa Day celebration with a health fair as well. Again, we'll be checking cholesterol, diabetes. We're giving lifestyle advice, glucose levels, well, diabetes. So other sorts of screening. Our nurses will be there and other health experts. So do join us down in London. Again, free event, and we're even providing breakfast as well, making sure that everyone is comfortable. We have a program as well called Keep Warm and Stay Safe for sorry, I missed the name of the project in specific, but basically we are helping you use energy in a safe way, in an efficient way. And within this, we also provide a series of things such as carbon monoxide alarms, electric blankets, which luckily you won't need today, but a series of equipment that are household items that are quite valuable, and we also giving them for free, making sure they are provided through our community. So come and check us both in London and Manchester. The details are on the chat. I wanted to thank you so much for joining us today and to stay with us until the end, and we shall see you next week. Bye-bye.
Thank you. Bye-bye.
Thank you.
Thanks, Dr. Lebari. Thanks, Natasha.
Thank you. Thank you very much.
Welcome to our Caribbean and African Targeted Health Improvement Programme, CATHIP Health Hour. The Caribbean and African Health Network, CARN, along with its national partners, are incredibly pleased to continue to bring to you targeted health and well-being education delivered by Caribbean and African doctors. These health hours are all about empowering, educating and giving space to Black people so our communities can look after themselves better. Every Saturday, our Black GPs or consultants present on those health and well-being topics that affect you, your family members and friends. Some weeks will vary and and will include other panel members such as pharmacists, specialist nurses and faith leaders. Our health hours cover a range of topics and include mental health, heart health, women's health, reproductive and sexual health issues, men's health, respiratory problems, cancer, sickle cell and many more. We have not forgotten to include within our health hours the many societal, cultural, religious and racial challenges that can go hand in hand with health problems and influence how we should respond to meet health and well-being needs. The sessions are designed for you, and we want you to use the time to listen, learn, share your experiences and ask questions to our Black doctors. During every session, we will gather your feedback so we can continue to respond to the needs of our Black community. To request any particular topic, please email health@carn.org.uk. We encourage you to invite others to our health hour sessions. Spread the word in our community. CATHIP is funded by the National Lottery.